Okay, so we'll start with the shoulder examination first. The first thing is inspection. Okay, so you undress him fully at the top part to look at the shoulders. So start with the front, inspecting for any obvious shoulder deformity, any dropping of either side, any obvious muscle wasting, bruising that you could see. Similarly, if you turn around, if you look from the back, similar things for any deformity, any shoulder drooping, and we look at the position of the scapula as well. Okay, if you turn around back, now first of all we start with palpation. So we always start with palpation. We'll start with the clavicle, palpate along the clavicle, moving forward towards the acromion, looking for any tenderness and sides, and then moving back towards the spine of the scapula. That's it. And similarly, obviously, you examine the opposite shoulder as well. Now, part of the palpation is you examine along the anterior joint line, the lateral, and the posterior. Okay. Now, if you turn around, as I said, we'll be examining along the spine of the scapula and the lateral edge. Okay. If you turn around again, now we do the range of movement. Okay. So if you just follow my movements. Move forward as high as possible, perfect, forward flexion, and sidewise move. That's it, keep going up, and so that was abduction. That's it. If you tuck elbows to the sides and move outwards, and that's your external rotation. Now, as we discussed, if you turn around this way, the other way, that's it. And if you scratch your back as high as possible, perfect, you check for internal rotation. That's fine, perfect. Now if you face the wall, we check the movements of the scapulae. So if you move up your scapula and down, good, and forwards, that's it, and backwards, perfect. So we check for any movements of the scapula, the position of the scapula, you'll check both in the same movements or not. Okay, turn around back. So we've done the movements examination, and now we'll do some special tests. Obviously he's done active movements, and his active range of movement is full. If needed, we could do passive range of movement as well. I will do the resistant movements. Okay, so if you put your elbows in the head again, and now push against my arms, perfect. So it's good external rotation, perfect. Now if you push against your belly with one hand was first, so you're checking for internal rotation. Now with the other one, or the other arm, pushing towards your belly, so it's got good strength for internal rotation. So the first of all, external rotation, I checked for infraspinatus, and when he was doing the pushing for internal rotation, do that again, push against, and that is for subscapularis, perfect. And now if you keep your hands like this, like that, forward, perfect, just relax yourself, okay. Now if you push against my arms, that's it. So suprascapularis, I'm checking. Now some of the other special tests. So these were the resisted movements for abduction, suprascapularis, external rotation, supraspinatus, infraspinatus, and subscapularis with internal rotation. Now, okay. First of all, we do the empty can test. So if you move abducted, forward, and internally rotated, okay, and I'll push against my arm. Suprascapularis again, or impingement syndrome you're checking for. Again, it's the same thing. We can do a scarf test. You have it like that. There's for scarf test if he's got pain, such as towards impingement syndrome. Okay, right here. Now, we can check for biceps tendon, any pathology with the biceps tendon. So you hold the elbow and ask him to bend his elbow against the resistance. So the bicep tendon is bulging. If there's any pain, such as towards bicep tendinitis. Stability of the shoulder, we can check in a few ways, moving the elbow, the humerus down, and looking for any gap producing between the head of the humerus and the joint itself. Now again, the other test we could do, stabilize the shoulder, hold the head of the humerus just, and move forward, backwards, look for any laxity and instability. There you go. And finally, yes, apprehension test we can do. If you hold your arm like that for instability again and push from backward, check for any instability of the shoulder joint. That was a quick examination of the shoulder joint. Obviously, you can do, the best way is to examine the shoulder, the joint above and below, to complete the examination, so checking for any elbow pathology that could give referred pains, and similarly any pains or pathologies from the neck referring to joint. So that would be part of the examination. Neurovascularly, you can check any pathologies from the shoulder joint going into your arm. If you straighten your arm for me, you can check for touch sensation. Can you feel my touch there? There, 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 there. Perfect. And if you squeeze my fingers, squeeze hard. Okay, that's it. Bend your elbows, pull it towards yourself, push against me. Good, perfect. And move it outwards and inwards. Perfect. Alright, that was a quick shoulder examination. Thank you.